So in order of the cranial nerve, and so each of these foramina are just going to be the first exits that they take in the bones of the skull. All right. So, okay, so the first one is something called the cribriform plate. Now the cribriform plate you find on the ethmoid bone, which is where? So in this view, what color is it? It's this green one right here. It nestles right in with the frontal bone. So the cribriform plate it's not very well outlined on this colored model. I'll get out one of the real skulls in just a sec to show you guys. But you can see it because there's a bunch of little penetrated holes in it. It looks like a bunch of little pigeonholes that are poked into that bone. And so the olfactory nerve is going to it's going to like split up into a bunch of little different nerve endings, and they're all going to feed through there. And so those then fuse down until they enter your nose, and they also are going to interact with the soft palate of your mouth. So that's part of how your sense of taste and smell are connected to. Okay. So the cribriform plate is going to be found in the ethmoid bone right here. And so the other part of the ethmoid bone you have to know is something called the crista galli. And so in a real skull, it's this big fin-like structure that sticks up off the ethmoid bone right there, okay? So crista, I always like, because galleys to me is like a very nautical or term. I would like, feel like it'd be something that you find on a boat. And so boats have rudders, right? And so rudders, it's gonna look like a rudder on a boat, right? So the crista galli and then the cribriform plate as well is there. Okay, so then the optic canal. So in the internal view, in the sphenoid bone, you're going to have these two holes that are on either side of the sphenoid bone. Right here, I'm sticking the pipe cleaner through it. So I'm sticking it through there because you can also see it exit through the orbit right there. All right, so that's going to be your optic canal. So what I'm going to do is I'm going to get out a bunch of pipe cleaners for you guys, and when you're handling the skulls later, you should put the pipe cleaners through the different foramina and see where they come out, because you're not only going to have to know what each of the holes look like from this view, but you're going to have to be able to identify them from the front and even the inferior. All right. So optic canal is going to be inside the sphenoid bone right there. All right. So that's going to be where cranial nerve number 2 exits. And then so for numbers 3, 4, and then the first branch of the trigeminal nerve. Those are all going to exit through something called the superior orbital fissure. And so just adjacent to the superior orbital foramen, you have the superior orbital fissure. And so a fissure just means a big crack, right? So it's going to form this, it's going to be the big crack still in the sphenoid bone, and so then that you're going to be able to see that come out through the orbit as well, right there. Okay? So those are going to be 3, 4, and the first branch of the trigeminal nerve. Then the foramen rotundum is, so still in the sphenoid bone here, there's a circular foramen. There's ones that have a bunch of different shapes and holes, so that each of the holes has like a different shape to it. So the foramen rotundum is the most circular one. So that's going to be in the sphenoid bone just about there. All right? And so then in a normal skull, you'll be able to see it. I mean, it kind of exits here, but it's going to exit really, really close to the lateral side of the maxilla there, so you might not be able to see it on this one, but on the real skulls you'll be able to. Okay, so that's going to be the foramen rotundum. And then the foramen ovale, still in the sphenoid bone, is going to be this big oval-shaped one. So we call it the ovale because it's like oval-shaped, right? So that's just there. That's going to exit through the bottom, just there. All right. So foramen ovale. Superior orbital fissure, again, for the abducens nerve, for cranial nerve 6, still going to be that superior orbital fissure, that big crack. So that big crack is probably pretty important because there's a lot of nerves that go through there, right? So superior orbital fissure. Internal auditory or acoustic gate. Sorry, I realize I'm sitting in the front of it right there. Okay, so the internal auditory, so I put auditory or acoustic because you can use either one. And sometimes I'll switch back and forth. But so the internal auditory meatus is going to be on the temporal bone, this big fuchsia pink one. It's it's going to, I'll walk around and I'll show you guys, but it's going to be this bone, or this little hole, just right there. Right. Sorry, my pipe cleaner is sticking. So that's your internal auditory meatus. Right. So the same thing for nerves 7 and 8. Those are both going to enter through there. Then the next big one is going to be something called the jugular foramen. So the jugular foramen is this big hole that forms based on the fusion of two bones. So which two bones is it forming based off of? The occipital and the temporal bone. You cannot have the jugular foramen unless you have fusion of these two bones. Okay? So in some of the skulls you'll see that the size of it is somewhat variable because everybody's different, everybody's skull is different, but that's where that's going to form. Okay? So that's going to be formed based off of the occipital and the temporal bone. And then finally, what you'll see is, so there's this big hole at the base of the skull that forms in the occipital bone called the foramen magnum. All right? You have to know that, absolutely. What do you think passes through there?
The spinal
cord, right? Spinal cord to the brain. I have a funny story that I'll tell you guys about in just a sec. But so on the internal rim of the foramen magnum, it's not very apparent in this model, but in the real skulls, there's a little tiny hole that fits. Let's see if you guys can see that. So it's just about there. You guys see that? Okay, so that is called the hypoglossal canal. So that's what your 12th cranial nerve is going to exit through. That's called your hypoglossal canal. All right? So those are all of the different foramina that you're going to be responsible for.